Welcome to the Reasonable Boy Politics Podcast 0010. What the Keir? So today we'll discuss what the Keir has happened to Labour. Keir Starmer has become the new leader of the Labour Party, and we will discuss a little bit about how that affects things going forward. We'll also discuss about the coronavirus and how this has affected the country at the moment and how effective or ineffective our government has been. So stay tuned. So, what the Keir is going on in the Labour Party? Keir has become the leader of the Labour Party, and he's been talking about an exit strategy for the COVID-19 virus and how, as a government and as a country, we come out of this in a more substantially organised way than what took place before. I've got no problems with that in asking for that. But I think Keir's been too deferential to the government so far, and I think this is part and parcel of his makeup. And I think what should happen is he should be putting the government under pressure for the things that it's failing to do. Getting personal protective equipment out to nurses and doctors, healthcare professionals, and people in social care and healthcare situations. That should be the number one priority, ensuring that those people looking after us have the right equipment and are cared for appropriately. And I think Keir could do more on that and be more effective on that. And he's been sort of missing in action, really. And that doesn't bode well for the future, I don't think. I'm still to be convinced that he will be not capability and intelligence in that, because he has that, but the political intelligence of the person in not just thinking, we're in a time of crisis, so I better not say anything bad about the government. Well, actually, in a time of crisis, by all means, support the government in getting across their message for people to stay at home and isolate and help the NHS. But also, as a leader of opposition, you need to make sure that when the government does something wrong, you come out very strongly against it. Not wishy-washy. You go out and say, this is wrong, you need to do something about it, what you're going to do about it, why haven't you done anything about it, and put pressure on the government. That's the whole point of being in opposition. It's not there to twiddle your thumbs and think, well, we can't say bad things about the government because of the crisis. We should be saying bad things about the government. For instance, Matt Hancock said that 19 NHS workers had died through the coronavirus. In fact, the total is 36. So why hasn't Keir challenged Matt Hancock on those figures? Why isn't he challenging the government at all about the way in which it is still pursuing, I think, this herd immunity, which is making sure that we are probably going to be have the worst number of cases and deaths in Europe, or we're heading that way anyway, unless something drastic happens. And so Keir needs to up his game. His front bench need to up their game as well. And I think the only person that's come out at the moment who's actually put the government under pressure has been Rebecca Long-Bailey. So I have real concerns. I know it's early, and people say, it's early, too early to tell. And this is a crisis, and people are made, or they are seen to be unable to cope with the situation. And I think unless Starmer gets a grip on the situation, people will look at him and say, well, in a crisis, you folded. And I don't want a Labour leader to fold under a crisis like this. It's too important. Lives at risk, and he needs to come out fighting for those people. So let's just wait and see what happens. So in this clip we'll see part of a briefing with Michael Gove and Sir Simon Stevens who is the chief executive of NHS England. And the interview took place with Andrew Woodcock from The Independent. And this actually shows a journalist actually doing their job for a change. And this raises some very, very tricky questions against Sir Simon Stevens in particular, as being head of NHS England, and the fact that they've reduced bed capacity and the cuts that have taken place with the NHS since 2010, and the fact that he was in charge from 2013-14 onwards shows, I think, a dereliction of duty by Sir Simon Stevens. And this journalist sums it up quite nicely. If you saw the images of this on the screen, you would see that both Michael Gove and Sir Simon Stevens' faces showed just how stinging a rebuke that was from Andrew Woodcock. And I think going forward after this crisis is over, certainly Sir Simon Stevens' position as Chief Executive of NHS England is not tenable any longer. And I think he should resign. And the fact that we haven't seen him for a number of weeks since this briefing took place, I think it took place in March, shows, I think, that considering there was a planned crisis management scenario set up in 2016 which covered such an eventuality as the coronavirus by the NHS and showed the government what was needed, what was required, and the then Health Secretary, Jeremy Hunt, who's also got a huge amount of questions to answer about this. Just because he's questioning what's happening now doesn't mean to say the spotlight shouldn't be on him. The NHS asked for the resources because of this, and they did not get them. So this is a big scandal, and we need to get the pressure on both Sir Simon Stevens, Michael Gove, Boris Johnson, Jeremy Hunt, Matt Hancock, and Dominic Raab, and Priti Patel, a whole lot of them, and keep pressure on to find out who made the decisions regarding this training scenario that they went through, who made the decision not to give funding. And I think this, like I say, this little audio clip sums things up quite nicely about the incompetence of this government that's got us into such a state at the moment. So here you go. Have a listen and make your own mind up.
And we'll turn now to Andrew Woodcock from The Independent.
Mr. Gove, there are large numbers of people all around the UK who are reliant on food distribution through food banks and other charitable efforts. These charities are still working, but many food banks have closed and donations are down. Many volunteers are over 70 and they've been advised to stay home. The Independent's launching a Help the Hungry appeal to support the London Food Alliance, but there's need right across the country. The government says it's supporting all sections of society through this crisis. So is there going to be financial and logistical support for these charities? Are any of the 700,000 people who volunteered to help the NHS being committed to this effort? And Sir Simon Stevens, could I ask, you've been head of the NHS since 2013. Do you regret the bed reductions and the failure to increase nurse training numbers during your tenure, which have left the NHS in a position where it entered this crisis with its critical care bed base amongst the worst in Europe, with Italy, for example, having twice as many ICU beds, and the UK having the lowest number of nurses and doctors per head amongst developed nations, according to the OECD? Isn't the lesson from this crisis that the NHS needs more capacity at all times if it's going to be ready to deal with this kind of surge in demand, and it can't be made to operate with no slack as it has been under your watch?
Andrew, thank you for those questions. On food and helping the vulnerable, let me say a few things. The first thing is I want to thank all those who work in food production and in our supermarkets for rising to the challenge of making sure that our shelves can be refilled and that people who need it are able to get the food that they need. Now, of course, we need more than simply to have an effective food production chain. We need to make sure that those most in need, those who are self-isolating, get the food and the other support that they need. That's why the NHS has identified up to 1.5 million people who are shielded, who've been advised to self-isolate for 12 weeks. And it's why government departments working together are ensuring that there will be food distributed direct to those individuals, with community pharmacies also providing the prescription medicines that they need. Now, there are people beyond that 1.5 million who are not self-isolating for 12 weeks, but who are vulnerable, people who in the past have used food banks, people whom we need to support now. And it is the case that the volunteer networks that have been set up across the country are ensuring that we can match volunteers who are willing to go shopping and to hand food to those vulnerable people who are staying at home or who may not themselves have the social networks to get the food that they need. And of course, the tremendous response to the Good Sam initiative that Matt Hancock announced earlier this week, with hundreds of thousands of people stepping up, is an amazing example of voluntarism in action and national solidarity. And we will be doing everything we can to support them. And my colleague Oliver Dowden at the Department of Culture, Media and Sport is looking at a specific fund in order to support charities in the work that they do. And we'll be saying more about this in the days to come. I also want to thank those people in the hospitality and catering sector who have stepped up and who are doing everything they can to support the vulnerable. John Vincent of Lyon is making sure that his stores remain open as takeaways in order to support the NHS. It's that sort of collaboration between citizens, the voluntary sector, backing from government and enlightened business people that I think will help us to beat this virus. And I'm grateful to you for the opportunity to thank all those who are making that contribution. I'll now hand over to Simon.
Thank you. So the NHS does need more staff and it does need more hospital beds, and we've been saying that for some time, and that is what's going to be happening over the next 5 and the next 10 years. But the reality is that what I've described is that over the last several weeks we have freed up the equivalent of 50 hospitals across England ready and waiting for coronavirus patients. Under normal circumstances, you would not keep 50 hospitals fully staffed with nurses and doctors not actually looking after patients, which is why no health service in the world, anywhere in Europe, anywhere internationally, would be able to withstand a coronavirus epidemic unless the sort of measures that the public are also involved with are also put into place. And that's why it's so important that the public support the work of our very pressurised frontline nurses, doctors, therapists and other staff across the NHS by staying at home and in so doing saving lives.
Thank you. And we'll turn now to...